You'll be so happy.
I hope everybody could see the movie.
Yes, ma'am.
Okay.
Yes, ma'am.
Okay, and you got the message also, I suppose. Okay. Okay, so now we are coming to the second session. Welcome back. Let us, of course, you watched the short film. I think that conveyed a lot of message about how this session is going to be. So let us begin. So we start with an activity. We have already watched the movie. So identify probable causes for vulnerability to psychological stress among women. So this is the activity now. Again, I want you to put it in the chat box. You have already heard about a number of issues related to women in all these days, so it will be very easy for you. So instead of me listing out the issues, I want you people to identify what are the probable causes for vulnerability of women to psychological stress. So quickly start with typing your answers, rather responses. Thank you. I will see your responses in the chat box. Abuse, harassment, lack of scope for individuality. Yes. Social insecurity. Right. Patriarchal society, insecurity. Yes. Health related insecurities. Right, madam. Social environmental factors. Yes. So other than MMTTC and myself, there are, I think, about 36, 37 participants. So I expect that many responses. Social environmental factors, hormonal changes, gender roles. Yes. Excellent. All of you are doing very well. You have made my work very easy. Psychological factors, financial difficulties, gender discrimination. Right. family non-support, male dominance, elites capture, traditional barriers, defenselessness, Kautumbika Taratama. Yes, please. No economic freedom, positive outlook. Manoj sir, how is positive outlook a vulnerability?
Ma'am,
Hmm.
just a minute.
Mm,
उसका है तो भी
sir, I'm
हेलो
not able to hear you properly. Is it network issue from my side or your side? In feed. Then
नहीं माय
please
साइड
type
से
it,
मैम
type it, sir.
इट्स हियरिंग इन
Managing professional life, not giving any prominence, inferiority, susceptibility, and lack of openness. Yes. Multitasks. Yes. Biological stress, social connection, interpersonal stress, traumatic life events, lack of appreciation, socio-economic disadvantage. Yes. Few more. I didn't get all 36 people to respond. So please, lack of respect to widows and old age people. Yes. Especially women. Okay. Workplace inequality. Few more. After one workplace inequality, nothing came. Quickly. Who all have not responded? Please write. Lack of economic freedom. Okay. Higher rates of internalizing disorders. Okay. ಸಾಮಾಜಿಕ ಆರ್ಥಿಕ ಮತ್ತು ರಾಜಕೀಯ ತಾರತಮ್ಯ. Right. Self-esteem issue. Problem of security. Norms, traditions, and cultural background. All right. Thank you very much. Difficulty in setting boundaries. Yes, very important. So I stop here. Thank you for your quick responses. Though I am sure all 36 have not given their responses, still so many have responded with multiple responses also. So thank you. Now let me just put those responses under some of the categories. These are not watertight compartments, but this is the short film that you watched just before I began the session. I thought we will do that first because it will give us a warm-up time for everybody and others to join. So I will not repeat the short film. So first and foremost, when we look at women's stress and vulnerability to mental illness, the first factor is biological or physiological. So in this, we look at hormonal imbalances that occur in women during her reproductive cycle. Reproductive cycle includes attaining menarche, menstrual cycle, pregnancy, delivery, menopause. These 5 stages have marked hormonal changes in a woman's body. And that affects the way she interacts with the people around her during those phases. Menarche is the first time when she starts getting her periods. And then the menstrual cycle begins regularly. You must have heard about proposal by the government on providing menstrual leave for the women every month. Why is that required? Many women suffer from premenstrual syndrome, which may include a lot of aches and pains in the body or stomach ache in particular, and also mood swings. So these cause a number of difficulties to many women, and these difficulties affect the way she works and interacts with people around her. And then pregnancy. During pregnancy also there will be a lot of hormonal changes. And then delivery, during delivery and then post-delivery period is considered as a very crucial period for women. Earlier, when the when the maternal and child health care had not developed so much, uh, many women used to die during the childbirth. So, when a woman successfully delivered the child and the child survived, means it was like a rebirth to the woman. And given our nation's uh, problem of malnutrition among women, if you look at it, in every household, generally women partake food after everybody has eaten in the family. So sometimes they may have enough food on their plate, and most of the times they try to adjust with whatever is there and they don't partake all the items which are required for a pregnant mother. That is why our government has come up with Janani Suraksha Yojana and special ration for the pregnant mothers and cooked food in Anganwadi so that the women get the nutritious food, not the whole family, whereas a pregnant woman requires that type of nutrition. So all these efforts are being done by the government to reduce anemia among the pregnant women and also impact due to maternal mortality. So all these efforts are being done by the government, but the fact remains that women suffer a loss of blood, a lot of loss of blood during delivery, and many times they die due to complications related to delivery. Of course, home delivery is almost gone except in the tribal areas. It is usually institutional delivery, which has given rise to more number of healthy children, newborns, as well as safe delivery for the mothers. But still, unfortunately, in Karnataka itself, we have had cases where maternal mortality increased in institutional deliveries, that too in a district hospital. So many young women died due to some, uh, you know, expiry dated drips being given to the pregnant mothers who underwent cesarean section. Okay. Except for such incidents, in general, maternal health and child health has improved in the country, but it is still not enough. It has not met the sustainable development goals given by the WHO, whatever it may be. But pregnancy and postnatal period are very crucial for the health of the women. Some of you may have heard of it that some women suffer from postnatal depression, postnatal psychosis, which is commonly noted as Bananti Sanni in Kannada. I don't know what it is in other languages. Many women, some women, uh, after delivery, become depressed. Sometimes they start hallucinating. And recently, on some news, I read that the lady put the newborn child in the fridge because she was depressed. The mother was depressed, and so young mother, she put the newborn child in the fridge and closed the fridge door. Luckily, somebody discovered it immediately and rescued the child. And the mother was taken to a psychiatric facility to help her recover from her depression. So, women at these points and menopause, obviously, when the periods stop and the reproductive cycle ends for the woman. It's a specific time period when the menopause happens. And during menopause also, women suffer a lot due to depression, hormonal changes, and nowadays many women have to undergo hysterectomy, that is removal of the uterus due to excessive bleeding and other issues. All these issues, biological factors, make the women vulnerable during their reproductive years. That means probably from 12 years to 12 to 15 years to the age of 50 to 55 years. So their productive age itself, in that every month they can have this postmenstrual, premenstrual syndromes. They might have difficulties during pregnancy, delivery, menopause. So all these factors are some which might contribute towards vulnerability to mental illness. And then we have somebody mentioned about widowhood and also old age while mentioning about factors. Longevity. Women live longer than men. Biologically, it is attuned like that. Even girl childs have a better survival rate compared to male children. But this longevity itself is a curse for women because usually Dr. Indira Jayaprakash used to say, one of the gerontological psychologists working for Bangalore University, she was earlier working, she said women in old age suffer from three handicaps, not just one. One is the gender itself, woman being the second grade citizen. Second is old age, and third is widowhood. If you combine all three, they are totally neglected. If you look at the earlier patriarchal system, if the husband dies, then the property would go directly to the sons, not to the wife and sons as it is now. So, indeed, where will the mother stay? In neither one of the sons or daughters' places. And where? In the house corner, or maybe in the kitchen itself. Otherwise, she has no place, no role, and generally neglected, and somehow she will have to pass on her life till death calls her. So this was the status of women, and this is the status of women in many families even now. So biological factor is one. Along with that, it gets combined with social factors and cultural factors. Then the second factor is the physical or physiological. Usually, women are smaller built than men. There are socio-cultural constraints, violence, abuse, and sexual harassment. All these factors are the ones which definitely affect the women in their day-to-day life itself. Okay, when you are bullied at school, when you are eve teased while commuting, or while going to work, or while going shopping, wherever you are going, the smaller physique makes you more vulnerable. Then socio-cultural constraints. There are so many factors. I'm sure you would have got it discussed during the previous sessions. And violence also. I'm sure they must have covered Domestic Violence Act or Sexual Harassment Abuse Prevention Act, and various Dowry Prohibition Act. All these acts are there. But whatever act is there, it is not enough to help a woman within the four walls of the so-called safe and secure house. POXO Act is there. But even then, how many children are getting exploited? Every other day, we read in the newspaper about teenage pregnancies. I know some girl delivering a child in the school, in the hostel, residential hostel where she is staying. 12-year-old girl being pregnant by someone known to her only, someone who is supposed to safeguard her. So, violence, abuse, sexual harassment, and rape, they all combine together, and all these experiences make her more vulnerable. Then, economic issues. Again, you all have mentioned it already. One is the many a times, all the surveys have indicated that number of working women have reduced in India compared to 30 years back, both in organized sector as well as unorganized sector. And who are the worst affected during the COVID period? Who were laid off more often than in among both genders? It is the women. And it is easily women are overlooked when promotions are to be made. Baseline salaries, except in the government service, they differ between men and women. Daily wages, the coolie given to the women is always less than that given to the men, whether it is in agricultural sector, construction sector, or any other sector that you take into consideration. There is always a pay disparity. Then caregiving duties are always given to the women, that is looking after children, looking after the adults, that is cooking and cleaning the house and all the things, and also looking after the elders in the family and household responsibilities. All this is unpaid labor, unacknowledged, unappreciated, and also uneconomical. So easily women do this work and get also the uh, you know questions from their spouses about what are you doing sitting at home. You simply sit in front of the television and watch television and gossip and while away your time. You don't know how difficult it is to go outside and earn. But unfortunately, they don't realize that women do much more work at household also, and the working women have the dual roles, sometimes three or four, multitasking. Somebody had mentioned multiple roles while managing the household as well as the work related responsibilities, and most of it goes unacknowledged. And even if woman works, most of the time the economic and financial independence is not there. Like we saw in that short film, many women, they earn, but the money is first given to the spouse, and the spouse will give her the pocket money. And that pocket money, other than the pocket money, every investment is made in the name of the husband in many families rather than in the name of the wife at all. So any property registration now, with the insistence from the government, at least in the ration cards, the head of the family is the senior most woman. That much change has been brought in by some proactive measures of the government. But as a society, we don't do that. And again, all this is supported by the social and cultural factors. So, generally, you look at it, whether religious programs, cultural programs, social programs, women do all the background work and they are always in the background only. They are in the periphery only, including, I have not added political. Most importantly, representation of women politically in India is so less. That is why the question of 33% reservation came. Actually, it should become 50%, but unfortunately, nobody would even think of it. Even this 33%, the current government has said that it will come in after the delineation of the constituencies and then God knows when. So, we don't know. And politically, very, very poor representation, except in the local government bodies, that is GPs and TPs and district level governments, local self government. But even there, if elections are not conducted, again, the representation of women is a big, big, big question. Then, pressure to conform. This is again internal pressure as well as external pressure to follow the trend which is there, whether it is peer pressure, social media, and the latest trend is cyber bullying. That is also where women are easily put to harassment. And last but not the least is access to care is usually ignored, neglected, or denied. So I talked about women's health when I talked about mental illness care. The same thing applies to most of the issues which are raised by the women. Either they are ignored, they are neglected or denied. And we also need to look at, the lack of acknowledgement of women's contribution. For example, in every household, agricultural household, the contribution of women to either, cattle rearing, farm activities, or even in the household, we have so many single income households due to various factors like widowhood, separation, or unwed mothers, or we also have, separation due to job. Man goes out on migration and sends back some money, and it is the woman who stays back at the native village looking after the children and bringing up the children. But very rarely it is acknowledged. So, these are some of the ignored, neglected, and denied identities of women, which also cause lot of frustration. And that frustration ultimately can cause stress and further lead to anxiety or depression, or it can be both anxiety and depression. So, again, this is not an all inclusive list. There are so many factors which you all know very well. So let us keep these dynamics in mind whenever we discuss the issues related to women, including mental health. So again, I said multiple roles, multiple tasks, and naturally there will be pressure and stress. So WHO has termed stress as the health epidemic of the 21st century. One of the surveys by Cigna Corporation in 2019, they indicated that 82% of Indians reported to be suffering from stress. And if we look at happiness index, we don't know where we are. We only, sometimes even Bangladesh and Sri Lanka and Pakistan go ahead of us in happiness compared to us. And the stress is because of multiple factors, and they are environmental factors, social factors, personal factors, and expectations from others. So many things are there. And everyone is stressed today. And COVID situation has worsened it, and it has negatively impacted women much more than men. Though many studies have not come, still some of the studies which have come have clearly indicated that domestic violence has risen sharply since the COVID epidemic. Work from home has caused men to become frustrated, and where will they take out the frustration? On the women who are available. There are so many videos on domestic violence in the YouTube. I don't want to put it because we all know the situation, first hand or second hand. Let us not have the ostrich syndrome and say that we don't have any violence against women in our surroundings. If we keep our eyes open, we will see various types of violence which is happening around us. And it definitely causes a lot of stress. And the stress has physiological, emotional, and behavioral components and consequences. What are the physiological components of stress? When we are stressed, we become either the anxiety is shown through wringing our hands, sweating, excessive breathing, or dryness of the mouth, and palpitations, that is heartbeats increasing, blood pressure increasing, so many. And emotionally, we feel, like I said, anxiety and depression, being tearful, being restless, not able to sit at one place, not able to concentrate. And all these are shown in our behaviors. Again, like I said, not being able to sit at one place, not being able to do one thing at a time with the same amount of concentration which we were giving earlier. And it will have consequences of ulcers, headaches, depression, mental illness. So many things will come along with stress. And heart attack is associated with stress, both physical as well as psychological. So all these factors make it, and also the moment, we all have to remember the mind-body relationship. The moment the mind is not okay, we are prone to committing more accidents, getting hurt. For example, if we are working in the kitchen and we have something going on, some stressful thing going on. So instead of cutting the vegetable, we can cut our hand with the knife. Or we may have sustain a burn while handling the cooking. Or we may have a fall. We may bump into something. All because of what? All because we are not able to concentrate on the activity which was going on there. And why does it happen? Because our mind is elsewhere. So that is simple thing. Or we may be driving a vehicle, and because of lack of concentration, we may get into an accident. So all this can be an effect or consequence of stress. Sometimes very concretely seen, sometimes the stress builds up and it causes harm to the body which may not be immediately visible. So now I want you to identify some common causes for stress. It would be nice if you can speak out instead of typing it in the chat box. What is the identified cause for stress? If you can share it, it will be nice. Quickly. What are the factors which cause us stress? Why do we have stress?
ಪರ್ಫೆಕ್ಟ್ ಆಗಿ ಮಾಡಬೇಕು ಅಂತ ಇಂಟೆನ್ಷನ್ ಅಲ್ಲಿ ಸ್ಟ್ರೆಸ್ ಬಂದ್ಬಿಡುತ್ತೆ.
Yes, because the pressure we put on ourselves to do things in a perfect manner. Yes. That can cause stress. Yes. Then,
Unrealistic expectations, ma'am.
unrealistic expectation about oneself and also from others.
Yes, madam.
Why parents put a lot of pressure on children to become, doctors, engineers, IAS officers, whatever. So those pressures regularly from quota, we get to see young students committing suicide when they go for coaching classes, right? Right. And then
Yes, ma'am.
other factors for stress. Only two.
ಭಯ
Is someone typing in the chat box?
ಭಯ ಮತ್ತು ನಾಚಿಕೆ ಮೇಡಮ್.
ಭಯ ಮತ್ತು ನಾಚಿಕೆ. ಓಕೆ. ಆಮೇಲೆ what are the common causes for stress?
ಸಮಸ್ಯೆಗಳನ್ನು ಸರಿಯಾಗಿ ಅರ್ಥ ಮಾಡಿಕೊಳ್ಳದೆ ಇರುವಂತದ್ದು.
Okay, not able to understand the problem. Okay, right. That can cause stress. Yes.
Ma'am, sometimes carelessness and negligence also will, contribute to the stress.
Okay.
Postpone nature also.
Postponing things. Okay.
Madam, improper time management leads to stress.
Yes, not able to manage the time. Okay. If somebody has written ಹಲವು ಕೆಲಸಗಳ ಒತ್ತಡ, expecting more from student or colleagues, then sankocha, health concerns. Yes. They are all causes for stress. And then ಅಷ್ಟೇನಾ ನಮಗೆ ಸ್ಟ್ರೆಸ್ ಆಗೋದು? Only this many factors?
ಮೇಡಮ್ ಇನ್ ಡಿಗ್ರಿ ಕಾಲೇಜಲ್ಲಿ ತುಂಬಾನೇ ಅದರ್ ದನ್ ಟೀಚಿಂಗ್ ಎಕ್ಸ್ಪೆಕ್ಟ್ ಲಾಟ್ ಫ್ರಮ್ ಅಸ್.
Yes.
ಆಕ್ಟಿವಿಟಿ ಮಾಡು, ರಿಪೋರ್ಟ್ ಕೊಡು,
ಯೋಜನಾ ರಹಿತ ಕಾರ್ಯನಿರ್ವಹಣೆ.
Yes.
ಪಾಠ ಮಾಡಿದ್ರೆ ಇಲ್ವಾ ಅಂತ ಕೇಳಲ್ಲ, ಬೇರೆ ಎಲ್ಲ ಸೊ ದಟ್ ಸ್ಟ್ರೆಸ್ ಫಾರ್ ಅಸ್.
Correct. Definitely. You have to do multitasking and more of report writing. Time management becomes a major problem. So, agreed. Health concerns, emotional thinking, daily hassles. Yes. What are daily hassles, madam? Drakshayani madam has written daily hassles. Can she elaborate on that? Drakshayani madam, please unmute and share. What do you mean by daily hassles?
Traffic, madam.
Traffic. Okay, good. Then
Noise.
noise. Okay. You're doing well, madam. Right things. More involvement to others, somebody has written. Okay. Thank you, madam. So, let us look at the factors which cause us stress. See, stress can be caused by both internal factors and external factors. So, these are some of the things which are covered, stress and coping under psychology. So, I have taken it from the text of psychology. All the factors that you mentioned, they also come under this broad umbrella of types of stressors. Okay. So stress is caused by a stressor. That is it. What is a stressor? It's a stress causing event or situation or factor. So one is pressure from multiple factors. The second is called conflict. Conflict is conflict of interest. For example, sometimes happy events also cause conflict. Sometimes difficult choices also make a conflict. For example, you would like chocolate and ice cream. You are asked to take either chocolate or ice cream. Then you are in conflict, simply to give an example. So, which one will you choose? You say, we want both, like how Tenali Ramakrishna is supposed to have told to the goddess that I will take both, milk and the curd, and he drank both. But very rarely in life, we are able to do that. So, conflict between two positives or two negatives. Okay. So, like for example, your student may get a very good job offer and may get a seat for a master's degree in a very good college. Now, what to do? Whether to go for work or to take up higher education. It becomes a conflict. Or the person may be asked to go on a punishment transfer or take demotion. Then what to do? It is like caught between the devil and the deep sea conflict. Likewise, in life, we get multiple choices or multiple conflict creating situations, and they definitely create conflicts and induce stress. The stress may be because internally we feel pressurized, or the external factors which come and which cause us to have stress. And then life events. What are life events? Events that cause an impact on our life. A positive life event can also cause stress. So does a negative life event. For example, among negative life events, loss of spouse is considered as, our life partner is considered as an extremely negative event. Similarly, parents losing a child is considered as an extremely painful life event. Loss of job, loss of financial security due to various reasons. During lockdown, we saw how lives changed. And similarly, when we have economic depression, or now with this tariff and the problems which are hopefully not going to come, but many people from US have been, or maybe will be asked to return to India, who have gone for better opportunities. So if they have to come back and restart their careers from the scratch, they are going to be major life events. So they can cause a lot of stress to people, both the returnees as well as those who are here. Similarly, positive life events. We say marriage is a happy event, but marriage can also cause stress, because uh, one side we will have a life partner that is positive. On the other side, the person will have to take responsibility for the spouse, for managing the household, for managing the kitchen, for managing money for both. I'm not saying marriage is stressful only for women. For men also, it will be stressful. So, because any change in situation means new challenges. If we take it as challenge and are able to deal with it, then it is good. If it becomes something for which we are not at all prepared, then it becomes a very, very difficult situation. And that difficulty causes stress and chronic illnesses, whether it is cancer or dementia or some stroke leading to bedridden patient in the family, then taking care of those people is not easy. Hospital expenses, caregiving expenses, if we hire somebody to take care, and bedridden patients for whatever reasons, they are very, very stressful for the caregivers, because the family will, as a whole, will have to make lot of changes to deal with one person's chronic illness. So that is also extremely stressful. And included in that is caregiving responsibilities for the chronically ill. Then Madam mentioned about daily hassles. What is daily hassle? On a regular basis, some things accumulate over one another. And finally, it is like the last straw on the camel's back. Then the person either has a breakdown or bursts out or has a burnout. All these things can happen. Like, for example, on a regular routine day, just think how many times you get stressed. If by any chance you get up late, then bathroom is occupied, so you get further delayed. And then for some reason the food is not ready, you cannot pack or send your child on time to the school, so you need to go and drop the child. And let us say on that day you have to attend a meeting with principal on NAC preparation. We are all familiar with that, right? And on top of it, when you go, you are already late. The principal has started the meeting and he gives you, he or she glares at you for going late. And you do all that, and then you have a class, you go to the class. Suddenly you remember that you have left the test paper which you are supposed to give on the day in the class at home, and it is not backed up in your computer. So you don't know what to do. You have to write the questions on the board. And then you come to the lunch, and when you open your lunch box and you see that there is no salt in the upma that has been made, what will you do? How many things, one on top of the other. So likewise, if you look at it on a daily basis, each one of us faces these little inconveniences. When these inconveniences go one on top of the other, they become daily hassles and they accumulate. Like how cholesterol accumulates in our arteries and veins, daily hassles accumulate on our mind. And they cause more stress without us realizing it. And that causes much more harm, that we stop enjoying ourselves and we reach a stage where we don't feel like looking forward to anything in life. And that type of stress can cause a person to become depressed, angry, upset, irritable, and generally a person with whom you can't live happily. And that causes problems in family, that causes problems in the work, and that causes problems in your social circle. Everywhere you start getting into trouble with people. And expectations about oneself and others. These are all the factors which can cause stress. Now, stress is there for everyone, but how do they manage stress? For that, we call the strategies as coping with stress. It is defined as the thoughts and behaviors mobilized to manage internal and external stressful situations. And when we talk about coping with stress, initially they talked about only two types of coping. One is problem-focused coping and second is emotion-focused coping. Problem-focused coping looks at changeable situations. There is a problem because morning time management is difficult. Before coming to college, I need to prepare so many things in the house. So it is a problem. How can I reduce the burden on me? By delegating tasks. That is problem solving based on changeable factors. So I might delegate bringing milk to one person in the family. Washing vessels, I may give to somebody else. Or, cooking, I may decide to hire somebody to cook in the house. So these are some of the factors through which I reduce the stress by making sure that the problem gets delegated to people and I get the results, so that I have less stress related to the problem. So this depends on the changeability. So they are all practical oriented issues. Then we have to have other type of coping called as emotion focused coping. Now when we talk about emotion focused coping, that comes when my interpersonal relationship is going badly, or my expectations about the other person or other person's expectation about me, they are not gelling well, or it can be due to a loss, due to death or separation or divorce or breakup. So many factors, interpersonal relationship related problems. Then they may be non-changeable. Like when I talked about parents losing their children due to death, or parents having children suffering from chronic illnesses. Now the loss and the sadness is something which cannot be changed. Those factors may be non-changeable factors. Under those circumstances, what the person can do is, I have given in the next subtopic, meaning focused coping. What is that? Why did have to God give me this misery? What is the meaning of all this? Then the person may go towards religion or spirituality to seek answers for such tragedies. And social coping, that is seeking support from support groups of parents who have lost their children due to road accident, let's say. They go and start meeting up with that group of people who have lost their loved ones in similar situations. So depending on the changeable and non-changeable factors, there are coping strategies which are adopted by the individual. So now that you know what is coping, you have understood about stress, you know about coping. Now I want you to start making a list of coping strategies that you use in different circumstances. So enlist one activity that facilitates mental health, including coping strategy, and are you practicing it? Because coping strategy helps in nurturing mental health. So, can you start listing in the chat box what is your coping strategy and are you practicing it? Quickly.
Madam, giving counseling.
Receiving counseling or giving counseling?
So if some student will approach us with some issues,
Okay.
and we'll try to give some
Okay.
Suggestions.
Okay. Providing counseling or seeking counseling. Okay. But what is your coping strategy? If you yourself are facing difficulties, how will you do? What will you do? Will you seek counseling? Two people have mentioned meditation. Very good. Yoga. And Dakshayani madam has said that she is doing meditation regularly. That is nice. Listening to music, long drive, break from the routine. Yes, definitely. Proper planning for time management. Yes. Self-analyzing. Yes. Again, problem solving. Yeah.
Pre-plan.
Pre-plan. Yes. Patience. Okay. Sometimes I wonder whether, it is so easy to say Kshamaya Dharitri. Forgive, be patient, one who waits will receive. Does it happen all the time? Being patient many a times may not be an answer when you are undergoing abuse. Just a thought. Counting 1 to 10 when you are angry. Yes. Dhyana, right. Then how do you cope? Generally, there are some healthy coping patterns and many unhealthy coping patterns. Like, for example, when I am frustrated, I go and have a drink. I smoke, or I shout at my family members, or I transfer my anger to somebody else who is lower than me, who cannot protest against it. Okay, so these are all unhealthy coping patterns. So healthy coping pattern is self-analyzing, counting, meditating, doing some involving oneself in recreation. So all these factors help us to deal with our emotions which are causing stress to us to come down. But external factors we need to see as to how far can we really have control over those factors. If they are not controllable, if they are not under our control, then how best to come to terms with the new challenges. That is what we need to look at it. Now, first, let me talk about coping and maintaining positive mental health of ourselves. And then I'll start talking about how we can help the students. So first and foremost, you all know about it. Still, I would like to repeat it so that it gets reinforced. So first is maintaining good physical health. That includes healthy diet, adequate water, healthy body mass index, avoiding unhealthy habits, including smoking, drinking, drugs, or excessive eating or avoiding food and getting into ulcers and other problems. Engaging in regular physical exercise or activity, adequate rest, that is sleep. Then having satisfactory social support and engage in hobbies. Identifying coping strategies, that is what are my healthy ways of dealing with stress and how best I can practice it, reinforce it, and let it develop much more in a positive way. And also identifying my unhealthy coping patterns and making sure that I will reduce it over a period of time. Then practice relaxation through deep breathing and relaxation itself, as well as meditation. Most importantly, practice gratitude, kindness, and self development activities, including hobbies. Usually, when we are caught up in the busy life schedule, we forget to give time for our hobbies. So, under those circumstances, it is important that we give some time for our own selves. What we call as me time, having me time. That does not mean we are selfish if we take time out, but we need that time to heal ourselves and get into the helping others mode. So, now when we talk about scope for intervention with student population. Now let us first see, before we look into this list, what are the main issues that happen to the students or the age group of students with whom you are working, because every group of students of different age groups have different challenges. Since most of you are in degree and master degree colleges, it is like the students have finished their adolescence, they are getting into young adulthood. So young adulthood, first and foremost, is best thing about it is that they have already made a selection about their academic career, and they have come in to whatever stream, science, arts, commerce, law, or whatever stream that they have chosen. They have come. When they come newly, they are getting adjusted to the college environment. They are making new friends, and they are having teachers who come every period and teach their subject and go. The classrooms may be big or small. If they are government colleges, definitely they are big classes. If they are language classes, they are big classes. So personal attention to each student may be possible, may not be possible. And depending on the interest of the students, and also there will be a variety of students who may have higher intellectual ability, average intellectual ability, and those who are struggling to cope with the challenges of education. They don't have one single textbook, multiple textbooks are there. They have to refer and make their own notes. Or if some notes is given, only reading notes is not sufficient to get a good result. Examination, everything. They have more independence, and also they have more financial requirements. Friend circles are different. Peer group expectation is different. So when all these things are happening, initial year, first year of graduation is time for settling down. But in a semester-based system with C1, C2, and final exam and compilation, multiple things happening in the college, and second semester usually college fest will come, some recreational activities. So there is no question of settling down. 3 years or 4 years will just fly by. But during that time, if you are alert teachers, you will see gradually the youngsters shaping up into adults with some maturity and some plan for future. So when that is happening, your support is very, very important for the students. One of the madams had asked me a question, what are the signs and overt behaviors of mentally ill person. So here we need to also consider that some students may become mentally ill during these 3 or 4 years that they are with you. And how do you know? One is gradual withdrawal from the activities, increased absenteeism, inattentive in the class. Earlier, if the student was very attentive and then becomes inattentive, then you need to wonder why. And also, being not very hygienic and failing in the examination. Earlier, brilliant student failing in the examination, looking distracted and not performing up to the mark, not mingling with friends, keeping oneself isolated. So all these things, if they are there, maybe you can call the student and ask them what is going on. Can you share anything? And if you are a good listener, and if you observe any change from routine in the academic activities, behavior, speech, emotional expression, interaction, eating, sleeping, and other activities, if you notice that, then maybe you can call and be alert to any out of context actions or deliberate self-harm attempts. That is, attempts to suicide. If they are there, you need to be alert to it. Okay. Sometimes students may come and say that, goodbye, madam or sir. Now, why goodbye? Goodbye should not be coming there, isn't it? Regularly we say bye or see you tomorrow. Instead of see you tomorrow, if somebody is saying goodbye, then there is something wrong. Why are they saying like that? So we need to ask the student, is everything all right? Why are you saying goodbye? Or if they give you a letter, or if they keep on saying about what is there in life, there is no point in living. So if they express some negative emotions like this, then if you hear such things, it is better to ask them what is going on in their life and what is going on in their mind. And in the context of girl students especially, I would like to highlight if there is any problem in her family. For example, in Karnataka itself, we have the national sample survey saying the teenage pregnancies are more due to teenage girl marriages. Okay, child marriages and pregnancies. And many a times, girls drop out of the college because they are forced into marriages. Sometimes they may marry willingly after 18. When they come to first grade college, probably issue of child marriage may not come. But the girl may be asked to marry somebody when she is keen on studying. Then the girls may agree for the family's pressure, or they may think of ending their lives too. That is a possibility. And sexual harassment, eve teasing. I mentioned earlier cyberbullying. Okay. So now is the trend. You all know about Instagram. They live for Instagram reels, YouTube reels. For that, they are ready to take any risks. And they were to be, the star of the day by having number of likes. So in this process, they may also get into some risk-taking behavior. We have read about so many youngsters losing life trying to take a selfie at near a waterfall and then falling down and meeting their death. So these risks that they take for the fame of the moment, at least as teachers, we owe it to our students to caution them about the consequences that can happen if they go in for these things. Similarly, drugs are a major problem nowadays. First, usually people take to tobacco, smoking or drinking or drugs out of curiosity. And usually the habit starts by 10th standard itself. Trying out what is there. It is forbidden, so I want to see. Okay. So this type of behavior will lead to, continuing to cultivate the habit for the sake of peer pressure. So again, when they come to college, the hold of supervision of high school to +2 is gone. So they are free to do what they want. So under these circumstances, the experimental stage is over. It would have become a habit, whether it is smoking, drinking, or drugs. And that habit can cause major problems throughout their life. So being alert to that and cautioning the students and having counseling centers within the college for such situations can help a lot. And also reckless, careless behaviors, whether it is driving or whether it is casual sex and relationship. It can cause especially unprotected sex can cause major problem for ladies. That is another thing. And sexual harassment at workplace, especially if some teachers are harassing the girl students. How best to help them? How to help them to lodge complaint with ICC, Internal Complaints Committee, and make sure that such situation does not happen in college. So these are some of the things that we can look into as teachers. And all children are not from affluent families. There will be students who are coming from lower socioeconomic strata who maybe have taken up work as delivery agents for Swiggy, Zomato, or all these platforms. What is that? Flipkart, Amazon, to help them with their college fees, with their expenses, whatever. So understanding their situation and helping them out, not financially, by being supportive to them can also go a long way in helping them when they require such help. And in case of, that is what I mentioned, in case of external situation, can there be any intervention to solve the problem? If so, identify and mobilize resources. That is in the context of if the identified problem is due to external life situation or internal life situation. Like, for example, external life situation was if it is like the student loses the father or mother, and so not able to cope with the loss is one, and not able to provide for money for the examination fees. One is a practical problem, another is an emotional problem. For practical problem, what can be done? Whether somebody can donate the fees, can something be done through college poor fund if you have, that is external situation. If it is internal, like missing emotionally, not able to deal with it, maybe if you have counseling service in the college, helping the student to get the counseling service, and ensuring that social support of the friends is available for that student to be able to cope with the loss. Okay. So, or if situation is so bad and the student needs some mental health intervention, like if they are into serious depression, then we can refer them to mental health professionals. So, and also if you know about any student who is undergoing treatment for mental illness, be considerate and compassionate. So this is very, very important. And also, I would like to underline and highlight this confidentiality. If you are helping a student, whether they are having some psychiatric issues, whether they are having relationship issues, or whether they are having financial issues, whatever help you are rendering, if it is a professional relationship, it should also maintain confidentiality. You cannot discuss their issues in public or in the classroom, citing it as an example. That cannot be done. So we need to be careful when we are dealing with it, because sometimes when we say this as an example also, that may hurt and humiliate the student who has received the help, and that may cause them to feel embarrassment, and they may feel publicly shamed because of that disclosure, and they may attempt deliberate self-harm also in such situations. So we need to be careful about it. So this is briefly about how we can intervene when a student is going through difficult times. So all this I have already covered. Still, if you are going through any of these difficulties, like for example, losing sleep, appetite, and peace of mind over the problems, excessive irritability, difficulty in managing anger, changed status of blood pressure, blood sugar, and burnout. So what you need to do, I said, social support taking. Talk to your colleagues, talk to your friends with whom you have confidence, in whom you have confidence, and confide in your family members, and seek help from a doctor if it is a physical health condition, or if it is a psychological one. See whether your coping and your resources are sufficient for you to handle these difficulties. Otherwise, seek help professionally without fear of stigma or what others will think. That is important. And enjoy the small pleasures of everyday life as much as celebrating great successes and milestones. This is very, very important. No, okay, the goal is there somewhere. No, I want to become professor, I want to become vice chancellor, I want to become registrar, I want to become UGC chairman. Fine, good, you have big goals, go for it. I want to become erudite scholar. Fine, I want to get Fulbright scholarship. Wonderful, go try for it. But in the pursuance of that goal, don't lose the small pleasures of day-to-day living. If you lose that pleasure, if you stop enjoying that, then definitely when you reach the goal and look back, you wonder, where did those years go? Where did I miss out on so many beautiful things that happened? Then you won't enjoy it at all. So the process is as important as the result. So those small pleasures, I tell everyone, identify and make a decision to live happily and make happiness your choice. There are so many things which go on, which hurt us so much. But in spite of it, if it's a bright day, okay, nice weather today, let us laugh. Let's enjoy this. Okay. So those decisions are ours to make. That is what Viktor Frankl, a Nazi concentration camp survivor, writes in his book. Things could not have gone more bad than that. But still, there were prisoners among us, our fellow Jews, who decided to live that day with whatever little happiness and comfort of one another's company. Okay, so that is an attitude. To live happily is a choice that we make. So if we can make that choice, definitely we all can be happy. we can maintain a good mental health. And if we are having a good mental health, then it naturally spreads to the people around us. So decide to live happily, make happiness your choice. And when that happens, you will be okay. Then I will stop sharing. Or can I share it now? Let me see. Let me try if I can share this. Okay, this is not showing what I wanted to show. So, okay, this is it. Are you able to see the screen?
Yes, ma'am.
Yes, madam.
Okay, okay.
Yes, madam.
Okay, this is an advertisement which came
No, madam. No.
long back.
We are seeing only the slides.
What?
Yeah.
Not this?
PPT slides. PPT slides we are seeing.
Oh, you're not seeing the movie, short film?
No,
Madam. No, madam.
Oh,
No.
I see. Okay, then I will
First
stop sharing.
you have to close this.
Okay. Okay. Was that closed?
Yes, ma'am. Yes.
So I have stopped sharing now, isn't it?
Yes, ma'am.
Okay. Now I will start sharing once again. Okay.
Yes, ma'am.
Yeah.
Now audible. Visual.
Yes. Okay.
What do you think of yourself? झूठ बोलने की आदत पड़ गई है तुमको. Just because I don't say anything. तुमको बच्चे की भाषा समझ में आई. एक और बार अगर ऐसा हुआ ना तो मैं एक फोन कर सकता हूँ. हेलो. जी हाँ, मैंने ही फोन किया था. Bring domestic violence to a halt. Ring the bell.
Okay. That was about it. See how best you can help by being a little proactive. That was the message given on International Women's Day, I think about 15 years back.